Hi, I'm Dr. Ron Miller, and welcome to Pursuit Physiotherapy. Today we're going over how do you know if you have true plantar fasciitis or not. Now, the telltale symptoms of true plantar fasciitis are normally you have foot pain in that one certain area right in the base of your heel. Your first step out of bed in the morning is painful. It feels a little bit better sometimes as you start to walk and as you start to loosen it up. And then when you do too much, you get that sharp pain right in that insertion area where the plantar fascia inserts on. Normally, sometimes it really doesn't matter whether you're flat-footed or you have a high arch. A lot of times the number one risk factor for true plantar fasciitis is the lack of ankle range of motion or dorsiflexion. That is the number one risk factor for that. And also, if you have a job that you're standing for long periods of time, probably in a bad type of boot or shoe, and then you get this heel pain. Okay, so the number one thing to kind of see is do you have true plantar fasciitis is look at your response to treatment. If you've been diagnosed with plantar fasciitis and you've received therapy, you've done treatment at the plantar fascia, you tried orthotics, you tried proper shoe wear with good orthotics. If those treatments worked, you probably had a case of true plantar fasciitis. Okay? Now, if you've tried those treatments and you failed the orthotics, you failed the therapy treatment, you failed the proper shoe wear, maybe there's some other risk factor present that you haven't solved yet that's predisposing you to getting this plantar fascia, or it's not true plantar fasciitis. Sometimes cases can be that you can have a dysfunction in the low back area that refers pain down to the bottom of the foot or to the base of the heel. True plantar fasciitis is specific, where your pain is going to be right where the plantar fascia inserts right on the heel. Now, if you have dull diffuse foot pain, or your foot pain is only at the base of your heel or the calcaneus and comes along the backside, maybe that's not true plantar fasciitis then. So the number one thing to tell you whether you have true plantar fasciitis or not is your response to treatment. If your treatments are working to treat plantar fasciitis and it's helping, you probably have a true case of plantar fasciitis. Better yet, all your signs and symptoms match the textbook symptoms of plantar fasciitis. But if you fail multiple treatment approaches and everyone's treating you for plantar fasciitis, but your symptoms are not changing or not getting better, then you may have something else going on. So if you like this, please share it on Facebook. If you're struggling with plantar fasciitis, or you're that person that you've been diagnosed with it but you failed multiple treatment approaches, give us a call today. We'll get you in for a thorough evaluation and really try to solve the problem of why you're having your foot pain, because it may not be plantar fasciitis. Let us know your thoughts and concerns, and if you have any questions, please give us a call. And thank you very much for your time.